Welcome to Women's Wealth, the podcast with me, Joanne. My mission is to educate, inspire, and empower you all to step into your own life of wealth. That feeling of being so rich in your mind, body, and soul. I'm so happy to have you here. Let's get straight into it. Hello. I am just interrupting the podcast before we start this week, just to say I'm back. The podcast will resume its weekly schedule. And if you haven't checked out my YouTube channel, I will be sharing. I have 3 videos for Wellth Wednesday that I recorded in Bali. So if you want to see me on my travels, please tune in. The first one will be going live on August the 21st. So that will be the Wednesday after you listen to this episode. I hope you enjoy it, and I will see you all very soon. Hello, and welcome back to another episode of Women's Wealth, the podcast. I'm your host, Joanne, and as always, very grateful to have you here. If you're returning, welcome back. And if you've just found me in the podcast sphere, welcome. And you might be watching this on YouTube, or you might be listening. So wherever you're listening, whatever platform, thank you. Always so grateful. I'm always so grateful to have amazing guests. And I have another amazing guest today. We're going to get straight into this. So we had a little chat last week, and I think today's podcast is going to shed a huge light on something. So it did for me after I just chatted to my guest for a short amount of time last week, and shed a huge light on our health and the way that we look at our health. So before I'll pass it over. So I have Trish Snyder with me today. She is an expert in mental health and functional medicine. So welcome, Trish.
Thank you, Joanne. Happy to be here.
Thank you. And yeah, so I want to ask you a question, and I normally end the podcast with this question. If you had one wish, your magic wand, and you could wave the magic wand and your work would have an outcome, what would that outcome be for the people that you work with?
I would wish that people were more aware of things that they could do to be proactive and to take charge of their health. Really the healthcare system at this point, we really approach it from like a systems approach. We look at it when there's symptoms and we're already having, some health challenges. We really don't focus too much on the preventative care. What can we do ahead of time? How can we live our best lives? What should we be focusing on? The way that the health insurance industry is, they don't cover for services that could do a world of good, that can help relieve our stress, that can, put us in touch with healthy eating, even getting a massage, so many good things that would be so important for us to incorporate into our regular health routine doesn't get covered. And I always find as a practitioner, we're just trying to chase symptoms, and we really should start from the beginning and really look at, let's focus on living our best and really looking at our health in a different perspective. So that way we can avoid, when our health problems take us down the line and we're just trying to chase, again, like I mentioned, chase symptoms and just try to find a solution after we've already had a problem. And we should really flip that script around. So that would be ideal.
Yeah, I love that. And I wrote the word down, I underlined it 3 times, proactive, because I completely resonate with you. And the work that I do is and for my own life, I've taught myself how to be more proactive because, and I don't know if you feel the same, it's something that we're generally not taught how to do. Why do you think that is? Why do you think it's kind of a taboo of, I guess it's sort of, being taught that you need to live this way, otherwise you could die a horrible death of something, if we were to break it down, but no one wants to sort of say that, do they?
Where do you think that stems from? Where does that come from, do you think?
I wish I knew. I know Western medicine, it's as a nurse, as my my training went, we didn't really focus on being proactive. We didn't learn about nutrition, using nutrition as food, for example. We didn't really look at blood work and analyze it in a way where we could sort of start treating some minor deficiencies and really getting our blood work at an optimal level. And I'm really not sure why that is, why we take this backwards approach. Western medicine, again, they're wonderful for the acute illnesses that arise, wonderful with the technology, the pharmacology, really they have a lot of advances in that. But when we look at chronic conditions or chronic symptoms, we really don't have a definitive way to approach people that are dealing with chronic pain and chronic symptoms. And it's unfortunate. I'm not sure, what the reason is, but it really, it is something that I think causes a lot of money in the healthcare. It causes a lot of stress, and also causes a lot of, sort of like, having patients feel bad and not knowing what to do about it, and patients feel lost.
I feel like with our health, it's kind of, we do the opposite to what we do with everything else. So in life, we do all the things, we go to school, we get educated, we build up to this pinnacle point that is supposed to be our, we're an adult, we're making money, and we work up to this point. But I feel with our health, it's like we just wait, but the point is a negative. So instead of it being, we're working up to this point, and then, it might not even happen. Does that make sense? So we kind of don't do anything until we hit this point. But the point in this case could be chronic illness, disease, instead of, like we do with everything else, doing the training, taking steps, learning about our health, and looking at things slowly. And then hopefully this point actually never comes, because we don't want to get there. And I'm sure, as someone that works in the medical profession like yourself, how different would your job be if, people like me who are not in the medical profession and others did have that sort of step-by-step approach, learning, eating right, learning about their own health? Like, how would that change what you do?
I think that would prevent or at least minimize the arise of chronic illness. And certainly, having this proactive approach and really teaching people how to live their best life, I think we could definitely reduce the amount of illnesses that people are experiencing, like with heart disease or with type 2 diabetes. We're really not focusing on the nutrition piece of it. Make sure you get plenty of exercise. Make sure you go get some fresh air and stress reduction techniques. We really don't do much of that until we experience, sometimes unfortunately, a heart attack or something just comes up, and then we're trying to, again, try to do something at that point instead of, way ahead of time. And I just feel like patients would be much better prepared, much more educated, and really they would become much more of an advocate for themselves if they were really armed with all of the knowledge and the information that is available to them. And for some reason, we just we don't really focus on that too much.
Yeah, we like flick through that chapter of life unless you go out and look for it. And it's really interesting, actually, as you were talking then about nutrition, that even myself, I'm guilty of this. I think that I would eat, and I would say, quite a healthy diet. However, even just the words, say, oh, I'm on a healthy diet. No, I actually just eat the food that I know is good for me. But we sort of label, if we're eating vegetables and fruit and we're replacing our sugar with a piece of fruit and no fizzy drinks and all of the above, we're calling it a healthy diet when it's just food. It's a food that we should be eating. It's not a diet at all. And, as you mentioned nutrition then, I was like, we've got such a warped view on the things that we should be putting into our bodies that we see as an alternative diet. Even in the supermarkets, there's a health food section where, it should all be, it's just food. It's
Yes.
the food that we need to eat, but
Mm-hmm.
then everything else is so accessible. Where
Yeah.
do you think so we'll stick with the education just for a minute before we turn into like the testing, but where do you think the education, or where we can get this information from, where should this start in an ideal world?
Oh gosh, I think as a child and in schools teaching about, how to select foods that are going to fuel our body. And I really like the fact that you mentioned, healthy food versus unhealthy food. And I think when we try to fit food into, one category or another, then that also can lead to problems and to negative feelings about what we're eating and what we're consuming, because there's no food that's bad. I mean, food is just food. Again, we want to make sure that the foods that we're selecting are nutrient, dense, that are going to provide fuel for our bodies, and that have a lot of vitamins. So we really don't want to label food as good or bad. But what we want to do is we want to look at, is this a little bit more nutrient dense for me? Is this going to be a little bit better? Is my body going to be able to use much more of the nutrients that are in this food rather than that food? Because then you get to a point where, well, I shouldn't eat that, like bread is bad, for example, or carbs are bad. And, really it took a long time. I'm in my 50s now, and I finally have a healthy relationship with food because, the healthcare industry and the fashion industry and just culture in general, they put all this emphasis on your appearance and your weight, and you should eat this and you should avoid that. So I got stuck in this, oh, I shouldn't eat this or I shouldn't eat that. And I really was sometimes restricting or avoiding foods. And then if I would have something that was technically bad, then I would end up having this guilt over it. And it was just, it was just this cycle of just this ridiculousness. And when I got older, I realized, no, food is really nutrition. And really, when I started really seriously weight training, and I hired a personal trainer, I competed in a bodybuilding competition, and I didn't realize how little I was actually eating. And when I trained for this competition, I had to eat so much more than I ever thought I could before. And it was like, well, wait a minute, this doesn't even make any sense. But it was truly amazing that I had to actually eat almost double what I was eating. And I was able to lose weight. I was able to put on muscle. It was just amazing. And that completely changed how I look at food. I don't look at food as I can't have this, I can't have that. I can have anything that I want. I just have to be selective with how much of a certain type of food I should have. And, these other foods are a treat, and it's okay. But everything's on the table. And it has just changed the way that I look at food and diet and nutrition and all of that. And it took a long time. And again, I think it's just this culture. You grow up and, you look at these actresses and people on TV and all this worth that they put on appearance. And then it just facilitates in our brains that this is the status that we should be achieving. And it just sets us up for failure right from the beginning, and it's not healthy. It just, yeah. And I think that's just a cultural thing. And we just have to change the way that we look at food, and we look at, exercise and all of that. So that was definitely an eye-opening experience.
And I'm sure, as you said as well, eating twice as much as you usually did and do in a day. Even I, for a second, I was like, oh my God, it is like a little, what? You've got to double your amount, and was kind of conditioned to think more food is bad. because we
Yes.
have, so we're shown all of these diets, these fad diets, and celebrities, and just over my lifespan when I was growing up, I think I've spoken about this before, but it was, I don't know if it was the same in the US, but in the UK it was Kate Moss, it was the waif. So no boobs, no bum. Like if my mum said to me, does my bum look big in this? The answer would be no, 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 definitely not. Nobody wanted that. And then it went to six pack. And then now I look at obviously I've grown up, and then you kind of get stuck in the mindset of what it was as a teenager, I think.
Yes.
And then I look at what the teenagers aspire to be now, and I think my teenage self would be like, absolutely not. No bum, no boobs. We needed to have, and that's just in the space of 30 years.
Absolutely. I just had this conversation with someone. My trainer was in her 20s, and we had this discussion, and you look around and I'm like, wow, these girls they are training for big butts and big glutes. I said, in my day, like, oh no, that would never be something that we would want. And she said, oh no, in my generation, that's what we want. We that we want a nice big round butt. And I thought, how interesting that has changed. And the other thing too is, at that time, like the Kate Moss and looking at exercise, we'd say, oh, I'd like to lift some weights, but I don't want to be bulky or anything like that. I just want to tone. And little did did I realize like how hard that would actually be to achieve, So just all of these thoughts that you think, if I just lift some, weights, I'm all of a sudden gonna like bulk up. And that's another like sort of misconception. And weight training is actually very good, especially for women, for bone health as we get older, even just to lose weight. The more muscle you have, the more calories you burn at rest. And this fear of I'm not going to do any weights, I'm just going to do cardio, and that's going to be great. It was another misconception and another thing that has changed over time when I was a young teenager and a young adult to how the belief system is now. So it is, and it hasn't been that long. Like you said, it's been 30 years, but what a difference.
Yeah, it's like there's a new wave every decade. So hopefully the next wave is understanding your body, listening to your body, understanding, and I think nutrition and the way that your body works. So let's dive a little bit into your work. So what methods do you use to help people to discover what they need to do and what they need to do to support their bodies and their health?
Yeah, so I've been working as a psych mental health nurse for a few years. And what I was finding is I work with children and adolescents. Initially, what led me sort of down this path to more of the integrative and the natural and functional approach was really parents who asked me for alternatives to medications. So I prescribe medications for mood disorders and attention deficit hyperactivity disorder. And I had parents initially saying, well, I don't really want my child to be on medications. What do you know about something that's natural? Are there any supplements I should be looking at that could possibly help my child? And I found I really didn't have many answers. I said, wow, I really don't, that's not something we learn. So it led me down this path of looking at health in a new way. And I got really interested in learning how to read blood work, but in a functional way. So as a nurse, I was trained to look at really lab values, memorize them within a certain range. And if they were outside of the range, they would be flagged. And if they fell outside of the range, that's really the only time that it would be looked at. And it would be a physician looking at the blood work in order to form a diagnosis. When I became certified as a functional blood work specialist, what I was able to find was that the ranges that we look for are much more narrow. So we're looking at optimal ranges. We're not just looking at normal, but what is optimal? And it's a much, much smaller range. And when I started to look at my patient's blood work a little bit more closely in this new way, I was finding that my patients had these deficiencies that I could see in their blood work that could be contributing to their mood and depression. So, for example, I found patients who had low vitamin D levels. Normal ranges for vitamin D in the traditional sense is anywhere from 30 to 100, and that's a really wide range. But the optimal level is somewhere around 80. So I was finding, wow, a lot of my patients, they're not even in the 20s. They're like, I had somebody in the single digits. And I had somebody in the 20s and so on and so forth. So I was finding, like, why aren't we doing something about this? Because yeah, technically it falls within the normal range. But if I have this patient who's been feeling down and depressed and tired, well, let's look at and see if we improve the vitamin D level first. What sort of an impact could that have on my patient's mood? So it brought me down this whole path of looking at blood work in a different way and really like, wow, there's a lot more in that blood work that I could be looking at and addressing that I could also be teaching my patients about. Underlying infections that are not going to be flagged in your normal labs, but they're low grade, which means that they're still producing or they're still having effects on the body, low-grade bacterial infections, which can present as GI stuff, GI symptoms, also low-grade viruses, that are festering, which can cause things like chronic fatigue and joint pain. And underlying viruses trigger autoimmune disorders. So, we really, we don't look at that, and we're not really doing anything about those infections. So it just completely changed the way that I view my patient's mood, different symptoms that they're telling me. Instead of, okay, here's this prescription for this medication, there you go. I like to look at, okay, let's look at this first and let's correct these deficiencies. Again, for the patients that are really wanting to have a different, more natural approach. Of course, medications are wonderful and they're life-saving, and I use them judiciously, but we should have more options available to patients in order to make an informed decision and have them choose. But definitely looking at the blood work and looking at all of these underlying things has definitely shaped my practice and how I approach my patients and people that come to me.
Just interrupting this episode to remind you to please like, subscribe, drop 5 stars if you enjoy listening to my podcast. It really does mean the world to me. And also to remind you, you can now watch every episode on my YouTube channel. Head to YouTube, type in Joanne Wellth, and I'll see you there.
Yeah, that's so interesting, and it's kind of makes sense, and it's really obvious, but then it's something that doesn't happen unless you go and seek this out. And as you were talking about vitamin D, actually, I didn't realize. So last time I went for a blood test, my vitamin D, I think it was 31. And the doctor did tell me that she said it was borderline 30. And I just thought 30 was, they didn't explain. She just said that it needs to be above 30. And mine was 31. So I was like, okay, I'm fine then. But obviously if it's on a scale between 30 and 80, then to me, then that's quite low. But I was just told that, oh, it's fine, it's over 30, so it's okay. So in my head, I was like, oh, it's 31. So, okay, fine. It's not a problem. Whereas ideally, I would want to be more 280. I did actually start eating more oily fish and taking a vitamin from it being 31 because she did mention it. So, but not everybody has, I work in wellness and I help other people to be well. So I sort of see something, I'm like, right, okay. But not everyone has that, that drive or that understanding of wellness, do they? So they would be told, yeah, you're fine, off you go, and off they go. Like I very nearly was.
Yes, unless it's flagged or, you're still within normal limits. Let's just recheck it, next year when you come in, or if you're having symptoms, and off you go. Instead of let's get that level up. And I do believe that the majority of us have low vitamin D level because, depending on where you live, you might not get exposed to as much sunlight as possible. And so it's really hard sometimes to get enough vitamin D. So I think it makes sense for all of us to just increase our vitamin D, especially in the winter, because vitamin D is also good for our immune system and it builds up the immune system too. So, that's one recommendation that I've, been doing ever since is get your vitamin D, no matter what it is, you could always use more because I have rarely seen anybody near 80. I mean, never. I think the highest I probably saw was probably 40. I'm like, wow, we should really be doing a better job. So, yeah. But
and it's interesting because I live in Dubai and it's always sunny, but everyone has low vitamin D here because it's too hot or just busy lifestyle. And after mine was like 31, I did start going out for walks and I stopped wearing sunglasses quite a while ago as well to try and help my, the vitamin D to, I don't know, I read somewhere, you might be able to fact check me on this, that, it can be absorbed through your eyes. So as long as the sun is not blinding me, I rarely wear sunglasses anymore because I need the vitamin D. So if I'm going for a walk, I won't wear sunglasses. I won't drive in sunglasses because my windows are a little bit tinted. Just these little things that I'm like, right, come on, because right now it's too hot to be out. And so I'm not getting any vitamin D by being outside. But yeah, thank you for sharing.
Sunscreen.
That's that. When you said those numbers, I was like, oh my gosh, if I wasn't okay.
Yeah.
And so when you were working with teenagers and adolescents and their parents were asking for alternatives to, medicines for ADD, ADHD, did you find that they had taken medicines and were suffering with, we all know about the side effects from some pharmaceuticals, or were they wanting to go down the more natural route straight away? How are the parents sort of dealing with this in your line of work?
Initially it was parents who wanted to go down more the natural route, but you're right about the side effects. They do come with a significant risk of side effects. And also when we're looking at patients who have been prescribed medications and they're still unwell, that presents another challenge is, okay, what about the patients that have treatment-resistant depression and all of these other things that medications are not really helping and addressing? There's patients that have tried multiple medications, they're still not well. So that could be another thing, like, well, we must be missing something in the functional world because this patient has literally tried every single medication and they're still feeling so down, depressed, they still have all this anxiety. So that's another area that I like to look at too. So initially it was parents wanting to try the natural approach first before the medications, which makes perfect sense. And then it's patients who I've tried everything and these medications don't work. What else could be available that I haven't tried yet? And that could be another, just another path that we could use. So I think a lot of people are definitely getting more and more interested in sort of more of an integrative, approach to things. Even things like sleep, like how much do we really even talk about how important it is to get a good night's sleep? It's so important. It had such an impact on your immune system, your stress levels, your mood, and that's not really something that's prioritized or ever talked about. I don't remember my physician ever asking me when I went for my yearly physicals, how much sleep are you getting? Are you getting good sleep? Are you waking up in the middle of the night? Do you feel rested when you wake up? No one ever asked me that. And it's so important, that we have a good mechanism for getting good quality sleep. And a lot of us are sleep deprived. And that's another thing that doesn't really get talked about, is really getting a good night's sleep, because a good night's sleep allows the body to heal and do what it does naturally. So we have tools, but we just are not using them as well as we should.
Yeah, and I think with sleep as well, in certain, I don't know, it's kind of the lack of sleep is one of a badge of honor with some people. And it's a little bit of competition, like who is the tiredest? I don't know if you find this, but I only had 5 hours. Oh, I only had 4 hours. And it's, especially I used to be a school teacher, and it was always who was the tiredest. And it was kind of, you would want that title. You never wanted to be the one that put your hand up and admitted you'd had 9 or 10 hours sleep, because it's then seen as lazy. Like, oh, you mean that you weren't working all night at home? So you kind of like, oh, like I do get some nights 9-10 hours, but I don't have children, so I know I'm different. And I do prioritize, because I have been in a state of not being able to sleep, insomnia, when I was struggling with hormones and anxiety, and knowing just how much my body craved sleep. Some days in the afternoon during my break, I would go to the toilet, set my alarm for 20 minutes, and have to close my eyes for 20 minutes and go to sleep on the toilet, on the back of the toilet, because my body was just exhausted. And I promised myself then, once I felt like I could sleep, I would sleep. And now it's a boundary that I set, even putting my phone away at 6 p.m. in the evening, so I'm not having any blue light. And nothing is going to disturb my sleep, because of how important it is and how much more productive I am when I've had that sleep. My low anxiety, high energy, but again, it's not something that people tend to shout about. Like, yes, I got 9 to 10 hours sleep last night. We only talk about when we don't, and pat each other on the back when we are tired. So yeah, sleep. If you're listening to this and you're thinking whatever swear words are coming into your head because I get 9 or 10 hours sleep, then you need to get more sleep. I actually saw a video, and it's just going to what you've just mentioned, on my socials earlier on today, and it actually said, and it was comparing our conversations with the doctor, and then if we have a pet. So I have 2 dogs, and the conversations with the vet. And it's funny that you mentioned that we don't get asked, are you getting enough sleep? Because that's one of the things that the vets ask when you take your dog. Are they eating? Are they drinking? Are they exercising? Are they getting enough sleep? The things that we also need to do, but when we go to the doctors, we generally don't get asked that. As women, it's when was your last period? And then I think that's it, really. They sort of ask you what's wrong. But those, sleep, water, eating, exercise, we do that for our animals, but we're not doing it for ourselves.
Right? It's really backwards. Yeah.
Because, and we know for ourselves as well, again, just, I can only talk for dogs, but I'm guessing it's the same for children. But I know if my dogs, if they're pacing around, if they're not sleeping, if they're not resting, straight away I'm on it. And if they're not drinking water, or if they turn their nose up at food, we know straight away there's something wrong with the dog. Instantly, we know, because they don't do that. And yes, they are more simple creatures to us, but those foundations, those needs, those basic needs are exactly the same. And again, treating ourselves like we would our pets. And I always compare ourselves to plants, but how we look after our plants, put them in sunlight. If they're dying, you water the roots. You don't just go and chop off all the bits that are dying. You look after them, you nurture them. Okay, Thank you for sharing that. It's very interesting about the blood work. What are your next steps then? So when you take the blood, it sounds like a vampire. When you take the blood, when you are testing the blood and you see the factors that are off, so let's just stick with vitamin D, for example. And is the vitamin B also one that's quite low in people?
Yes, low vitamin B levels can also be linked to depression, fatigue, low energy. So yeah, and the blood work that we're talking about is just routine blood work that if you had a physical and your doctor said, I'm just going to order a set of labs, this is part of the labs that they order. So it's nothing that's really out of the ordinary. It's not anything special. It's a complete blood count, which is, again, a very basic thing that gets ordered. Also a thyroid panel, iron panel, blood sugar. We like to look at the blood sugar panel as well and see how that's developed over time, cholesterol. So again, these are just, normal blood work that anybody can get. It's just looking at them in a different way,
Yeah.
And so I like to, when I'm working with patients, I like to just have a set of standard blood work right off the bat, initially, just to kind of see what's going on. And if their physical symptoms, have anything to do with how they're feeling. And that should be routine because in psych mental health, for example, whenever we had patients who were admitted to the hospital or so on and so forth, we would have to rule out any medical conditions first. So it should just be a standard thing that we have. So just to kind of get a baseline and see over time if there's been any changes, see if there's any additional symptoms, so on and so forth. But it is something that I usually start out with, and then I do a complete intake. What symptoms have you been experiencing? I ask them about sleep. I ask them about nutrition, exercise, stress management reduction techniques. So I've been trying to incorporate all of those things in a functional role a little bit more and take that a little bit more into consideration with, the patient's beliefs and what they value. And it's just opened up a whole other opportunity to provide a lot more teaching than my prescriber role, which is, okay, let's talk about your symptoms. And I have been getting blood work too, just again, to make sure that you're not feeling down and depressed because of, that. But then it's just a quick, how are you feeling? How's the medication working? And there you go. And it's unfortunate, that our traditional, role in medicine is really that, just chasing symptoms, trying to, find the pill that's going to work and then get you on your way. So I like to have this whole approach and take everything into consideration because we're made up of a lot of different things. It's not just our mood, it's our spirituality, it's our physical being, it's everything. And if one thing is off, the whole thing can be off, Mental health disorders can cause physical problems, and physical problems can cause mental health disorders. Spirituality concerns can cause, problems. So we're all connected, and we're only looking at different snippets at one piece of the puzzle, when in fact we really should be looking at the whole puzzle and trying to get the whole puzzle to fit together and to work together.
And it's definitely more that there needs to be a shift in becoming more preventative medicine, I guess it would be called, rather than just, like you said, it's symptom medicine, waiting till you have the symptoms. But if you look after yourself and you work on preventing, those symptoms may never come around. As you were talking then, actually, another analogy that I thought, I don't know if you have the same in the US, but in the UK, we have an MOT for our cars. And every year we have to take the car for an MOT. So they check the oil, I don't know all the checks, I'm not sure. I just follow the rules and I take it. And it's a prevention, and it's making sure your car is roadworthy, and it's preventing, any blown out tires, any engine brakes and oil leaks and all of the things. And again, the medicine that you're talking about is us looking after ourselves in that way. We're preventing, we're checking, we're making sure everything's in working order. If there's something that's, even just borderline, okay, what can I do? Go for a walk in the sunshine. Amazing. It's not a bad thing to be told you need more vitamin D. Get outside, eat some oily fish, green vegetables, or vitamin B, or whatever it is that's showing up, iron. Treat yourself to a steak, spinach, if you had meat. Some of these things are so simple and enjoyable. You need a little bit more exercise. Okay, and you need vitamin D. We'll go for a walk in the sunshine and maybe just walk a bit quicker. Like, some of the preventions are very enjoyable, and it's things that are also then going to have a knock-on effect for our mental health, because we're outside in nature, we're enjoying the sunshine, maybe staying out long enough to watch the sunset. And how amazing, every single time I watch a sunset, it makes me feel so I love it. It makes me feel very human, very humble, very loved, in love, just so grateful for another day. And that's just by watching the sunset, all of those feelings.
Yes. So true. So true. It really does a lot, and like you said, it just connects you with nature and connects you with, just the outside, and just taking it in, and just like smelling the air. Or like, I love going to the beach and just listening to the waves and the sand. It's just complete relaxation, and I just am in total bliss whenever all I have to do is just be out there, and it's just amazing. It does so much for my well-being and how I look at other people, and my mood is like so much more elevated. It's just amazing. And you mentioned very simple things that we can do, and sometimes we try to make it complicated, but it really isn't. It's just getting back to the basics, getting to nature, getting back to the basics, eating food that's good for us, that you find in the environment, that doesn't have all these, chemicals, and isn't processed, and all that good quality, stuff. And making sure we're hydrating too. And it's amazing. It's amazing what it can do for your whole self-esteem and your physical well-being as well.
Yeah. Oh, thank you so much for that, which takes us full circle in just being proactive, exactly what you said at the start. So all of the information you've shared today, the listeners taking that and just seeing what small changes they can start to make, starting with blood work. If anyone has any questions for you, where can they find you? I will put the link in the show notes, but share that while you're here as well.
Yeah. So they can find me at wholehealthalternatives.com. I offer some do-it-yourself at-home programs too. I also teach workshops. I have live workshops that I host, and I invite people to come along on the workshops, bring their blood work, whatever blood work that they have. And I teach some of the 5 markers that can indicate whether or not you have an infection. And I also teach another workshop that has to do with our brain and our thyroid health. So you can look at that on my website, wholehealthalternatives.com. So I'll be having a workshop this month, and then another workshop in August. If anybody is interested, it's free. And if you can't join live, as long as you register, you'll have access to the replay, where I go in and I talk about the different ranges and what you want to look for, and things that you want to ask your doctor about, just to be better informed, especially if you're one of those people who have been told that your blood work all came back normal, everything is fine, but yet that there's something not quite right.
Yeah. So that intuition, I talk about that a lot, but we know when there's something not quite right. So yeah, maybe I'll go for a new blood test. I'll be in one of the workshops, because now after hearing the numbers for vitamin D, I'm like, oh, I want to know what the others were now. So I just remember vitamin D. But thank you very much, Trish. It's been a pleasure having you.
It's been wonderful to be here.
Thank you. And thank you everyone for listening. I will pop Trish's information in the show notes, and I will see everybody next